Hi, this is Susan Peterson from Peterson Physical Therapy. Again, it is Mobility Month this January 2022. We have done thoracic spine, we have done posterior chain mobility. We're going to add on, be a little more specific with that posterior chain today, and we're going to look a little bit closer at your ankle mobility. So the ankle kind of gets ignored because everybody just says, oh, I have tight ankles or I have flat feet, but a lot of times there's more to it. Sometimes it's actually a weakness issue. A lot of the times there's some range of motion stuff going on, things that we just need to kind of work out a little bit. So we're going to show you a way to assess your ankle mobility at home to see if it might be implicated in knee pain, hip pain, back pain for sure, foot pain, all those plantar fasciitis people. Lots of things that the ankles are actually, I mean, they're your connection with the ground, so they're super important. And so we want to make sure we've got lots and lots of mobility, and we're not finding other ways to cheat around that mobility. So we're going to start with Scott. You're going to set yourself up. Now this goes for anybody that can kneel. You want to set yourself up, so back up about 4 or 5 inches. You got long legs, there we go. So you're going to set up your front foot approximately 4 inches from the wall, so you can measure it if you want. You want to try to be nice and tall, and this is not a balance test, so if you need to hold on to something, that's perfectly fine. All you're doing is basically just shifting forward through the hip and trying to see if you can get your knee on the wall, okay? So a lot of times we see people that are like, yeah, I can do that. But if you come around this way, and you look at his ankle and how this foot kind of completely collapsed in, that's how he got to the wall, okay? So if I change that up and make him maintain that arch, he can still do it, but he's, just a little bit more stiff in that rear foot there, okay? The other thing that we want to watch, and Scott's doing a good job, is that they're not twisting or torquing off of that leg to get that knee to the wall. If he does this, then there's no problem. He can get that knee to the wall, no big deal. Let's see who's next, Kaylee. So we're gonna do the same thing. And Kaylee, why don't you go ahead and cheat a little bit so we can, let's see if I can pick out your cheat here. You might not have to cheat. So the other thing to look at, actually, if you come around the back here, you can see Kaylee's toes went straight to the outside. And what that causes is all the weight loading through this leg is going through that medial foot, right? So you got that plantar fasciitis. People that are told they have flat feet don't always have true flat feet. It's more of a compensatory thing, because if you're stiff back here, you're going to figure out a way to get that knee forward. So what I would do with Kaylee is bring her back, make her put that foot straight, and then as she leans forward, that knee has to stay over the outside of that foot. And now she's not getting to the wall, right? So hold right there. Good. Everything up here looks good. She didn't do any of that shifting, cheating that we were talking about earlier. But that's something that maybe we should probably look at. Again, Kaylee's a swimmer, so swimmers, soccer players, dancers, gymnasts, anybody that does a lot of work on their toes, those swimmers with their feet pointing pretty much the entire time they're in the pool. This is something that we're going to find. So the other limitation to this particular test is people that can't get down on the ground. So our older folks who just aren't comfortable getting down on their knee, whether they have knee pain or just aren't comfortable, we can modify the test a little bit, and we'll have them put their foot up on something a little bit higher. If we can get them with the knee up here at about 90 degrees, maybe a little bit lower, but the table doesn't go any lower than this. And you're going to do the same thing. So they can hold on. We put this here for Stephanie, and then we're going to see how far can she get forward. Yep. So does she have to arch her back to get that knee forward? Does she have to drop that knee in the way that Kaylee did, which is what Stephanie just did too? So those are all things that we want to look at. We want to see that knee going in front of those toes. 4 inches is a perfect measurement. Not a whole lot of people that have perfect range of motion, but that's kind of what we're looking for. So any gain that we can get. I guess that's another good point is for all these mobility tests, perfection is not the goal. Any improvements that you can make can impact your symptoms. So any little bit of range of motion that you can gain from a stretch or a certain mobility activity may make a significant impact on the complaints that you might have. So come see us. Let's see what we can find.